The following is a health podcast that provides general advice only. Please speak to your doctor about any specific health concerns you may have. Assalamu alaikum and welcome to Health Bites, a Ramadan health podcast brought to you by the Australian Islamic Medical Association. During our last podcast, we talked about people who shouldn't fast and the importance of seeing a doctor before Ramadan to discuss how fasting may affect any medical conditions someone might have. Today we'll be focusing our discussion on pregnancy in Ramadan. My name is Dr. Seema Selman, and joining me today is Dr. Rania Abdu, an obstetrics and gynecology registrar in Canberra. Thank you for joining us, Rania. It's good to have you.
Thanks for having me.
That's good. Many people say that the process of pregnancy and childbirth is one of the most physically and emotionally demanding experiences in a woman's life. Let's start there. Could you give us an overview of some of the changes that occur in pregnancy?
Sure. Heaps, basically. So physical, emotional, psychological changes, and it probably begins prior to pregnancy during the conception period when you're kind of tracking your cycles and trying to get pregnant.
Yeah.
And then after that, obviously, in the first trimester, a whole bunch of symptoms. So fatigue, nausea and vomiting. You might have achy joints. If you have any spotting or bleeding, that's probably a warning sign. You want to go to your doctor to check that out. And then moving on to the second trimester, you'll have breast tenderness, again sharp shooting pains.
Yeah.
Your spine the shape of your spine changes during pregnancy to accommodate for the growing uterus, and that can put pressure on the nerves in your legs, and that can shoot down your legs. And then further on, as you go into the third trimester, you start having increased urinary. So you're going to the bathroom often to pass urine. You get lots of pressure, pelvic pressure symptoms, pelvic girdle pain, and you start feeling like you can't take a deep breath in because obviously the pregnancy's pushing up onto your diaphragm, so you feel like you can't take a deep breath in. So lots of blood changes, your blood volume increases in pregnancy. Respiratory changes, basically a lot of physiological changes happen throughout pregnancy. And then emotionally, if it's your first baby in particular, it can be very nerve-wracking if you've had miscarriages in the past, or difficulties falling pregnant, or if it's an IVF pregnancy, or if you've got any other medical conditions like diabetes or blood pressure problems, then that can also be have an impact throughout your pregnancy. And then there's all the nerves when it comes time to having the baby and going through labor. That's probably one of the most difficult things any woman is going to go through, but it's also the most rewarding thing that a woman can go through, which is why I'm so privileged to do what I can do, that I can help kind of make that process as safe as it can be for mum and baby.
Yeah, that sounds really incredible. Tell us what goes through your mind, or the thought process behind advising a Muslim woman who's pregnant whether or not she should fast.
Look, obviously the first thing I think of is what the Islamic ruling is on it, and as you know, pregnant women are exempt from fasting in Ramadan, and essentially the medical advice is not to fast during pregnancy, and that goes throughout all of the stages of pregnancy. I understand obviously that women feel that they'd like to be part of Ramadan, and it's kind of a bit sometimes upsetting to feel that you're left out, and that you feel that you want to fast. However, we have evidence that fasting, for instance, in the first trimester can increase the risk of hyperemesis gravidarum, which is basically nausea and vomiting of pregnancy. Fasting in the second trimester can increase the risk of something called preterm labor, which is when you have your baby way too early. And if it's less than 24, 25 weeks, the baby may not survive. Anything from 24 to 28 weeks, the baby may be born but have quite significant disabilities. So it's certainly a really big thing to think about going into preterm labor. And other issues have been identified, like having a smaller size of the placenta, the baby being smaller, and babies not moving as much during the ultrasound. due to reduction in the mum's blood sugar level. So overall, the medical advice and the advice from the College of Obstetricians and Gynecologists, the nice guidelines, overall the recommendation is not to fast during Ramadan while you are pregnant.
Yeah. And I guess leading on from that, I know the general advice is not to fast. Are there any categories of pregnant women who absolutely hands down must not fast during Ramadan?
Definitely women who have underlying medical condition that requires medication regularly during the day, and in particular women with diabetes. So women who've got gestational diabetes, which is diabetes of pregnancy, and women who have pre-existing diabetes like type 1 or type 2 diabetes, they need to closely monitor the blood sugar levels, and they need to be testing their blood and having, taking if they are using insulin, for them to be then eating the right amounts. And having too low or too high blood sugar has dangers for both mum and for baby, and that can be a whole topic on its own. But essentially, if you've got any kind of medical condition, you've got heart problems, congenital heart problems, lung problems, kidney problems, any kind of any medical condition that requires regular medication, you absolutely should not be fasting.
Yeah, okay. So next question is, I guess there's a lot of advice out there in mummy blogs, magazines, Facebook, family members, everything under the sun on what types of meals we should be having while we're pregnant. If a woman decides to fast, or if she's not fasting, are there any rough guidelines on what we should be eating and drinking, either at night if we're fasting or during the day if we're not?
So that's a huge topic.
Yes, loaded question.
And something I'm actually passionate about talking about. So I think there's a huge a bit of a misconception that when you're pregnant you're eating for two. So the first thing to say is that in the first 12 weeks of pregnancy you actually do not need any further increase in your calories or food intake at all compared to pre-pregnancy. So in the first 12 weeks you absolutely do not change what you're eating at all. And then after that, so after about 14 weeks of pregnancy, if you are of a healthy weight, then the only increase to the amount of food that you would eat during pregnancy is the equivalent of a cheese and tomato toasted sandwich.
Oh, wow. Okay.
Yep, that's it. Yep. And then if you are of a high BMI, the only amount extra you need per day is the equivalent of one slice of toast. So it really isn't that much food at all.
It's almost the opposite of eating for two. It's eating just for yourself,
just for
really.
You,
and plus a snack.
Tiny little bit extra. Yeah, exactly. Yeah. So, and that leads me to BMI, which is also something that's kind of really important for us to talk about. So in pregnancy, it's important to have a healthy amount of weight gain, and that is dependent on your pre-pregnancy BMI. So basically it means that it's a measurement of your height and your weight, and a low BMI, which is less than 18.5, you would the recommendation is to gain between 12.5 and 18 kilos. If your BMI is between 18.5 and 25, you should be gaining between 11.5 and 16 kilos. If you're overweight, so between BMI 25 and about BMI 30, you should be gaining between 7 and 11 kilos. And if you're obese, so BMI greater than 30, you should only be gaining between 5 and 9 kilos. And if your BMI is greater than 40, then you should actually not be gaining any weight at all during pregnancy. So it's a lot less than women think. Certainly shouldn't be gaining 20 or 30 kilos per pregnancy. That is way too much. An excessive gestational weight gain, or excessively gaining too much weight while you're pregnant, has huge consequences. Having a high BMI prior to pregnancy causes infertility, causes miscarriage. Having a high BMI throughout pregnancy causes increased risk of gestational diabetes, high blood pressure problems requiring an induction of labour, higher risk of caesarean section, more chance of difficulty with breastfeeding, and higher risk of something called VTE, which is blood clots in the legs and lungs. So you absolutely need to pay attention to what your BMI is prior to pregnancy. If you're planning pregnancy, you should lose weight. If you're already pregnant, you should really need to stick to those guidelines, and weighing yourself often is the best way of monitoring your weight gain, which then leads us to what kind of food to eat in pregnancy. And there's definitely a lot of resources online, particularly the New South Wales Government Food Authority has a great website which has a big table on which foods to eat and not to eat. And essentially what you're trying to avoid is salmonella and listeria.
Yeah.
And while listeriosis is rare in Australia, if a pregnant woman does contract listeriosis, there is a 1 in 5 chance that the baby will die. So it's pretty serious. So you really need to eat the right foods.
Yeah.
And some of those things on the list will surprise you. I think most people know that you don't need to have that you shouldn't be having raw food and soft cheeses and things. But rock melon is something, for instance, that I didn't know about until recently. That's actually something that you can't have. If you have leftovers for longer than 1 day, then you can't have that. You can't have stuffing from inside the chicken, no raw runny eggs, and that includes if you're making cake batter or pancakes, whatever, don't lick the spoon.
Resist the urge.
Yeah, that's right, yeah. No pre-cut fruit or veggies, no processed meat like salami, no cold cooked chicken, and obviously all the soft cheeses like ricotta, blue cheese, and feta. No soft serve ice cream. Yep, shame.
Avoid the ice cream, the soft serve. Yep.
And the other thing obviously to bear in mind is you need to be on taking your pregnancy supplements, so making sure that you're on a pregnancy specific multivitamin that contains an appropriate amount of folic acid, vitamin D, and iron.
Yeah. Okay. All right. Now we're going to switch gears a little bit. I know the general advice is for women who are pregnant not to fast, but are there any specific symptoms or warning signs that should prompt a woman who perhaps has decided to fast to break the fast, even if it's 10 minutes away from iftar time?
Oh, absolutely. So the key thing is to avoid dehydration in pregnancy, and that can have a pretty significant impact on your kidney function.
Yeah.
So if you start feeling dizzy or faint, if you start feeling very thirsty, if you feel like you're not passing much urine at all throughout the day, or your urine is very concentrated, and you're feeling quite fatigued or quite hot, then you should definitely break your fast.
Okay. Some women can develop diabetes when they're pregnant, and this can affect the baby and complicate the delivery if it isn't picked up. Can you tell us about the test that's used in Australia to diagnose gestational diabetes and when it's done? And would you recommend breaking the fast to have this test?
Yes, I would recommend breaking the fast to have this test. So it's a routine part of managing pregnancy to screen for diabetes. And if you didn't have diabetes prior to pregnancy, you could develop gestational diabetes, which is diabetes of pregnancy. And most of the time, that diabetes goes away after you've had the baby. So the test involves basically getting 3 blood tests done over a 2-hour period, and you need to be fasting initially to do this blood test. So you do the first blood test while fasting, and then they'll give you about a half a cup of a really sugary drink. It tastes a bit like a very sweet lemonade. Then you have that drink, and then your blood gets tested at the 1 hour mark and the 2 hour mark. And usually it's done at the 26 weeks of part of your pregnancy. Initially, prior to that, you would get tested in the first trimester if you have any risk factors for developing gestational diabetes. For instance, if it's your second or third pregnancy and you had gestational diabetes in your first pregnancy, if you've got a high BMI at the beginning of pregnancy, then you would qualify for an earlier blood test, and you should break your fast to do that test.
The point of this episode was to open a discussion about fasting in pregnancy. As a final question, what would you say to a pregnant woman who's listening to this and perhaps is feeling sad about not being able to fast in Ramadan, given the fact that we're saying that we probably shouldn't if we are pregnant?
I mean, I can totally understand it. And I know I've been in situations where I've, had to kind of talk to women in antenatal clinic and explain to them why they shouldn't be fasting. And I understand that they're disappointed and they're upset and they feel left out and they feel like they're missing out. And also there's the other concern of, well, now I have to make up the fast later. Look, you just have to, mum's health and baby's health always comes first. And I think that's the important thing. And it is Islamically, when pregnant women are exempt from fasting. It's like when you're traveling, you don't go out of your way to pray every single prayer. If you can join your prayers, you do join your prayers.
Yeah.
And it's the same thing for pregnant women. That exemption is there. The wisdom of Allah is there for a reason. And you can still partake in, tarawih, and you can sit down and have iftar with everybody else, and you can still be part of the spirit of Ramadan without kind of having that extra added risk to yourself or to the baby.
Yeah, and I think that the point to reinforce here is being pregnant is one of the most amazing and also physically and emotional experiences of a woman's life, and to feel guilty about not fasting is to say that those changes don't matter or they're not significant, and they actually are. They're huge. Thank you so much for your time, Rania. It's been great to have you and speaking to you. Tune in next time for another episode of Health Bites. Thanks for joining me. Next time we'll be talking about fostering a healthy mind and healthy body. Until then, assalamu alaikum everyone, and thank you for listening.